In this video, I'll explain the role of in-clinic treatments and the power of dual care in-clinic treatments, plus at-home maintenance. In-clinic care offers personalized consultation, professional assessment, and a tailored long-term treatment plan. It addresses deeper concerns like rejuvenation, collagen stimulation, and anti-aging repair. These effects go beyond the reach of home skincare alone. Lasting results require more than just products. They need targeted clinical intervention. Skincare alone isn't enough. The skin's barrier limits how deeply products can work. In-clinic treatments go deeper, targeting concerns skincare can't reach. Together, they deliver faster, longer-lasting results. Why skincare alone isn't always enough. 1. The stratum corneum barrier, the outermost layer of the skin. The stratum corneum acts as a protective shield. However, it also limits how deeply active ingredients from topical products can penetrate. This means many ingredients never reach their target layers, leading to reduced effectiveness. 2. The role of in-clinic treatments. Professional procedures such as microneedling, laser, or RF create temporary pathways or stimulate the skin's natural renewal, enabling deeper delivery of active ingredients and more significant clinical results. 3. Treating what products can't reach. Topical products are often limited to surface-level issues. In contrast, in-clinic treatments can target deep dermal structures, addressing concerns like skin laxity, acne scarring, and vascular lesions that topical skincare cannot effectively treat. 4. Synergy equals better results. When paired with professional treatments, skincare acts as a supportive system, helping maintain results, reduce downtime, and prolong treatment benefits. The combination delivers faster, longer-lasting, and more visible improvements. 5. Enhanced ingredient activation. Some active ingredients like growth factors, peptides, or vitamin C work better when delivered into the deeper layers of the skin. In-clinic modalities can enhance bioavailability and activation of these compounds, maximizing their potential. 6. Prevention and repair. Combining home skincare with periodic in-clinic treatments creates a preventative strategy. While skincare maintains daily health and hydration, clinical treatments stimulate repair, collagen production, and long-term rejuvenation, tackling aging at multiple levels. Please comment, subscribe, and share. Aesthetics and Skin Institute is a global leader in online aesthetics learning.